Hi, I'm Dr. Erin Jeffries, and I'm an OBGYN. I've been practicing in the Community Physician Network since 2021. I decided to go into medicine after my caring for my grandparents as a child. So both my mother and my father cared for my grandmothers for most of my childhood. And shortly after my grandmother, my mom's mom became really sick, she had an encounter where she had a doctor that really changed the course of her end-of-life care, and that really had an impact on me. And my mother actually became unemployed and went back to nursing school, and so I actually helped her study when I was in my preteens. And so really after that, I decided, I really want to do something medicine. I really loved helping her study. I really loved knowing that I could make an impact in people's lives, and so I knew at that point that I was going to do something in medicine. Choosing a specialty for me was really hard, actually. I wanted to do everything. So I wanted to do surgery, but I also really knew that I wanted to have a relationship with my patients. So it was really hard for me to find that, and ultimately I found that in OBGYN. I get to do different things every day, whether that's delivering babies, doing surgery, but ultimately I get to establish a long-lasting relationship with patients, and that's what really matters to me. I think I really value the opportunity to enter into the lives of women. I think that what I learned in training the most probably was that it's not only the most exciting time in a woman's life, but it can also be the most challenging. And so I think that it is really an honor and a privilege to be asked and welcome into that space. I chose community because they're patient-focused, and I really think that matters. As a patient myself, I think it matters to feel heard, and I think that I wanted to join an organization that really valued that, and so I chose community. Outside of work, I love spending time with my family. I don't have a family of my own, but I have an older and younger sister who have families, so I have lots of actually grown nieces and nephews, and then I have two little nieces who I spend lots of time with when I can. They are currently 3 and 5 and just a blast. And so anytime I'm off work, I'm usually driving to Southern Indiana to spend time with them. I'm Dr. Erin Jeffries, and I'm an OBGYN. I've been practicing in the Community Physician Network since 2021. I think at the end of the day, I just want patients to know that I do care about the whole person, whether that's mental, emotional, physical, spiritual health. I care about addressing all of those things. And I want them to enter into my office and know that I'm going to listen to all of those things. I want to hear all of those things. And so I want them to walk out of my office feeling heard, because I know that there's power in that. And so I want patients to know that but if I don't do that, I'm in Indianapolis hiking or biking or just spending time outdoors. I really enjoying creation and kind of getting some free space to clear my head and just enjoy. So.